Cutaneous manifestations of hepatitis. What is hepatitis? Hepatitis is another specific term for inflammation of the liver. Hepatitis may be caused by alcohol, drugs, toxicity or allergy, gallbladder disease, autoimmune disease, metabolic disease, infection by parasites, bacteria, fungi, and symptoms. There are acute and chronic forms of hepatitis which may result in nausea, jaundice, fatigue, and abnormal liver function blood tests.
Hepatitis A and hepatitis E, they're both foodborne illnesses and usually present like a gastrointestinal manifestation. Nausea, vomiting, poor appetite or anorexia, jaundice, abdominal pain, fevers can all be associated with these illnesses. Pruritus or itching occurs when you have jaundice. This is more protracted in the case of hepatitis E. They're usually self-limiting and resolve by themselves. Hepatitis B, based upon the age of acquisition, could be symptomatic or asymptomatic. In the United States, it tends to occur in the adulthood, related to either sexual or intravenous drug use as a transmission risk. In these patients, they usually tend to be symptomatic with an acute icteric phase or an elevated liver enzymes, just like acute hepatitis A.
Hi, I'm Dr. Bindu Balani. I'm one of an infectious disease physicians here at Hackensack University Medical Center. Different viral hepatitis present in different ways. Regarding hepatitis A and hepatitis E, they're both foodborne illnesses and usually present like a gastrointestinal manifestation. Nausea, vomiting, poor appetite or anorexia, jaundice, abdominal pain, fevers can all be associated with these illnesses. Pruritus or itching occurs when you have jaundice. This is more protracted in the case of hepatitis E. They are usually self-limiting and resolve by themselves. Hepatitis B, based upon the age of acquisition, could be symptomatic or asymptomatic. In the United States, it tends to occur in the adulthood, related to either sexual or intravenous drug use as a transmission risk. In these patients, they usually tend to be symptomatic with an acute icteric phase or an elevated liver enzymes, just like acute hepatitis A.
Skin size of acute viral hepatitis. Acute urticaria is commonly observed in patients with viral infections, including hepatitis A, hepatitis B, and hepatitis C. Urticaria associated with fever, headache, and painful joints in snow and certain sickness. Light reaction and affects 20% to 30% of patients with acute hepatitis B. The hepatitis A has been reported to cause an extended similar to scarlet fever, erythema multiforme, and erythema nodus. Skin size of chronic liver failure, jaundice, yellow skin and eyes, melanocytes, cutis brown patches, epidermis, angiomas, primary erythema, red palms, caput medusa, distant veins radiating from umbilic, straight marks on nodular prurigo due to severe itch.
Also yellowing of the whites of the eyes, called the scleral icterus, and a yellowing of the mucous membranes of, say, the mouth. There's also yellowing of the soles and palms of the hands, and if you look very, very carefully, a distinctive yellowing of the skin, which we call jaundice. Now, there is little difference in icterus between people who are dark-skinned and people who are light-skinned. If you look at a dark-skinned person and you cannot see the yellowing of the skin, you can always look at the sclera, or the whites of the eyes, which turn distinctly yellow in patients who have severe hepatitis. Hepatitis affects all sorts of things. The hepatitis A and B are both hepatitis where vaccines exist, and so one can be immunized against both of those. Unfortunately,
Dr. Bob Lahita, the chairman of medicine at Newark Beth Israel Medical Center and professor of medicine at University of Medicine and Dentistry of New Jersey. This segment is called How to Recognize Hepatitis. Hepatitis is inflammation of the liver. The way to recognize a disease is fairly easy. When something involves the liver and inflammation of the liver, there's a loss of appetite, lassitude and fatigue. There's also yellowing of the whites of the eyes, called the scleral icterus, and a yellowing of the mucous membranes of, say, the mouth. There's also yellowing of the soles and palms of the hands, and if you look very, very carefully a distinctive yellowing of the skin, which we call jaundice. Now, there is little difference in icterus between people who are dark-skinned and people who are light-skinned. If you look at a dark-skinned person and you cannot see the yellowing of the skin, you can always look at the sclera, or the whites of the eyes, which turn distinctly yellow in patients who have severe hepatitis. Hepatitis affects all sorts of things. The hepatitis A and B are both hepatitis where vaccines exist, and so one can be immunized against both of those. Unfortunately,
cutaneous manifestations of hepatitis C. The hepatitis C virus is an RNA virus, is a major cause of both acute and chronic hepatitis. Persons become infected mainly through parental exposure to infected material by blood transfusion or injection with no steroid needed. Extrahepatic manifestations of hepatitis C virus are numerous. The most prevalent and most closely linked with hepatitis C is essentially missing cerebral globulins with dermatologic, neurologic, renal, and rheumatology complications.
Are most often located on the shins, with papules aggregating into broad-based plaques. Vesicles or bullae may appear. Persistent brown staining develops after the lesions resolve.
Antibodies to hepatitis C are detected in about 16% of patients with cutaneous lichen planus. Lesions that persist become thicker and dark red. These hypertrophic lichen planus lesions are most often located on the shins, with papules aggregating into broad-based plaques. Vesicles or bullae may appear. Persistent brown staining develops after the lesions resolve.
Hepatitis C is a major public health problem because it causes chronic hepatitis, cirrhosis, and hepatocellular carcinoma. The hepatitis C also induces extrahepatic manifestations such as measles, thyroglobulinaemia, porphyria cutaneous tarda, and leukocytoid vasculitis Lynch-Planus.
Are not helpful. We do have oral antihistamines that we use, including Benadryl and Atarax. These can assist with symptom addition, particularly at night, and also assist with sleeping. If skin rash does become worse, at that point we do have a dermatologist that we refer our patients to. It is important to notify us if rash symptoms worsen. Interferon can cause excessive.
A non-soap product such as Cetaphil is recommended. Also, Aveeno oatmeal soaps can help to relieve some irritation and also assist with relaxation. Using moisturizers after baths and shower can also assist with symptoms. And it's important to remember that creams are more effective than lotions. If these interventions are not helpful, we do have oral antihistamines that we use, including Benadryl and Atarax. These can assist with symptoms.